It's a pleasure to get to talk to James Smith, who's a professor of public health at the Menzies School of Health Research. And James, you're joining us from a hotel room. What are you doing there?
Oh, that's right. I'm in hotel quarantine in Brisbane at the moment, having recently returned back from the United States after spending 4 months on my Fulbright. So at the moment, it's very much locked down in the room. I'm here with my family across a few different rooms at the hotel, and we're just staying out the period. So 1 week down, one to go, and then I've got another 2 weeks in home quarantine when I get back to Darwin.
So when you talk about that quarantine, just so people understand, both in the United States and here in Australia, how strict is that quarantine? You're a family of 6.
We're a family of 6. We're in 3 rooms in the hotel, and 2 of those rooms are adjoining and one's not. So I'm in a room with my son, who's 16 years old, and my wife and other 3 kids are in the 2 other rooms, and we're not allowed to move between those 2 rooms. It's against the law for us to do that, other than catching up with them on a fresh air break once, maybe twice a day. So it's fairly isolating, but we are being well looked after, and we know that we're safe in the confines of the hotel.
And you are just back from Michigan, from the University of Michigan. Is that right?
Yeah, that's correct. We had 4 months in total in the US as part of the Fulbright. That included 2 weeks at Vanderbilt University in Nashville, and then 3.5 months in Ann Arbor at the University of Michigan. And 3 of those 4 months, 3 in Ann Arbor, were in lockdown in our house that we were staying in Ann Arbor.
So it's been a Fulbright like no other, but there was a very fascinating, indeed important and powerful synergy between your research and actually what's been happening in the world, particularly in the United States. I know that your area is health research, particularly as it affects people of color. You're there during a pandemic and during what began as protests over George Floyd's death in police custody, and have extended to protests about racial injustice in the United States. What was it like to be studying exactly what you're studying at such a time in the United States?
It was certainly something that I never thought would evolve in the way that it had. The focus of my Fulbright was around strategies to reduce health inequities among boys and young men of colour. And you're absolutely correct. We've seen protests around the world, not just in the US, but globally, around anti-racism, around addressing the structural and systemic barriers that Black and people of colour face on a daily basis. And that aligned amazingly with the work that I was doing. And in fact, it reinforced some of the things that I was looking at in terms of some of those structural and systemic barriers that create and recreate health inequities for boys and young men of colour.
Yeah, well, particularly in terms of, because the 2 things are related, as has been discussed many times. And I know with the pandemic, it's been shown that it is disproportionately affecting African Americans, both in terms of the economic impact, but also in terms of death and illness and outcome. Tell me what you've learned about that.
That's right. So there's been researchers across the globe looking at the gender implications of COVID. And what we know is that whilst the infection rates are about the same as they are with women, what we find is that the severity and the mortality related to COVID is more pronounced among men. And you're absolutely right. It's more pronounced among those that are most vulnerable in our community, whether that's related to race, so whether that's Black or Native American or Aboriginal and Torres Strait Islander people back home. But we also know that it relates to age, the elderly, those that are that have existing chronic conditions. And then there's a whole range of other influences, including those things that are linked to social determinants of health, that are linked to education, that are linked to justice and incarceration, that are linked to housing and whether people have homes or not. And those are the types of things that I was actually looking at through my Fulbright experience is to what degree do those things recreate health inequities and social inequities that are experienced by boys and young men of colour. So it's absolutely important that we start to think about, well, what are the strategies that can create change, that can provide a more positive world for these boys and young men.
And, you know, obviously your Fulbright was interrupted in a way. I mean, you could never have anticipated that it would unfold the way it has. But what did you come home with in terms of your desire to change things and what you've learned specifically from this program at the University of Michigan?
Yeah, well, it's been amazing. So I guess what it's reinforced to me is the importance of working across nations, thinking about global partnerships. And we've already been talking with University of Michigan and Menzies and how we can continue to collaborate once I return, specifically in the area of health inequities with boys and young men of colour. And one of the reasons I went to the University of Michigan is that Professor Daphne Watkins, who's based there, who heads up the Centre for Health Equity Research and Training, the Curtis Centre, she's done some amazing work around, again, young men of colour, specifically black men, and engaging them in university. So it's a social and educational project that she's worked on there, and I was really keen to learn about that. The interesting thing is that that's an online intervention. So it's something that fits really well with our current practice in the world today. We've all been engaging in Zoom meetings like we never have before. And she's already got something there, her and her team, that's ready-made to be able to support young black men in terms of their health and well-being. So we've got to start to look at those pockets of innovation and see how those can be adapted to other contexts nationally. And certainly I've been interested in some of the synergies and differences between Aboriginal and Torres Strait Islander males back home in Australia and work happening with Black and Native American males over in the US. Lots to learn from each other.
Absolutely, lots to learn from one another, and in particular when it comes to Aboriginal and Torres Strait Islanders here in Australia. Certainly the Black Lives Matter movement in the United States has spilled over, and there has definitely been a spotlight on what's happening to Indigenous populations here. What can you say about that?
Well, the reality is that the issues are similar. So we see those problems in terms of racial inequities that we see on a daily basis in terms of the justice system, in terms of incarceration rates, in terms of deaths in custody. And those issues are fairly consistent across Black lives or African American lives in the States, Native Americans in the States, and Aboriginal and Torres Strait Islanders back home. These are ingrained health and social inequities that we really need to start to address as a broader community. And I'm hoping that at least my Fulbright experience and some of the outputs that are starting to come from that will be able to influence some thinking in that space.
Do you have oh, I'm sorry, I didn't mean to interrupt you. Please go ahead.
No, I was just going to say it's, but that will take time. Things like racism are things that are entrenched in society, and it's going to take a long time to move beyond that to deal with notions of white privilege and white supremacy and what that means in terms of movements like Black Lives Matter. We've got to edge slowly, but we've got to do it with conviction. We've really got to make the change that we need to see. What we're seeing at the moment is unfair, it's unjust, and we need to see that change at a societal level. So hopefully, I guess the international research collaborations of this nature and those that are connected particularly to applied contexts that can influence practice and policy can start to make some positive changes in this space.
I mean, many people are saying this feels different. There's an urgency, there's an immediacy, there's a sense that people are finally getting it. You were there, you were in Michigan as this was all unfolding. Can you comment on that? Yeah,
certainly the civil society action that I saw in the US was amazing. There were protests across all 50 states. And yes, there was some civil unrest associated with that, but in the main, they were peaceful protests. These were people that were speaking out, and these were people both of colour and white people that were coming together to say, this isn't right, we need to see change. And we did see that, as you mentioned before, spill over into the Australian context as well. I can't comment on, I guess, to what impact that has had, but what I can say is that I've never seen or experienced anything like that in my life before. And certainly in talking to people in the US, the only comparable things that they had, I guess, were some of the early civil rights movement days, going back to Martin Luther King and the like. So certainly there's a mobilisation like no other, but history tells us that we need to be persistent, that we can't give up, and that we need to keep thinking around these health and social inequities and addressing those as best as we can.